live and just share a few thoughts. And today I'm coming back just with this subject concerning our eyes, looking after our eyes. There are a number of times that people have asked me questions. I've been working in the eye clinic for the last 18 years. I worked with different people, different doctors, consultants, nurses, and colleagues in other departments where we've been looking after people's eyes. And it's such an encouragement and a blessing to work in the eyes. I've learned a lot in the last 18 years that I've worked in the eyes here in Birmingham, in the United Kingdom, and also having been going to Zambia to do charity work in the area of eyes. So it's been a pleasure working with these great men and women, my colleagues, and I've been learning from different people, and coming to looking after eyes is very, very important. Sometimes we take it for granted, and there are times that we have no idea what is happening to our eyes. Sometimes people tell us to put things in our eyes that we shouldn't put in our eyes. So today I'll just run through a few things and just concentrate maybe on one condition, blepharitis. But let's recap. In my previous video, I did mention some of the common eye conditions that people can experience, and you may relate or you may know somebody that has that condition, and we can always be there for one another. And as I'm sharing this, I would encourage you that whatever I share is just to help you, that you can go to your opticians, you can go to the doctors, you can go to any clinician to just help you understand what is happening to your eyes, and also seek treatment at the earliest time, because when there is early intervention, you can avoid consequences that may come after, especially with eyes, because certain conditions, if they are not treated early, you might end up losing your vision, or you might end up losing your vision or losing your sight and becoming blind. And of course, it might not be a good thing that you get to that stage. But the earlier you notice something, the better. So you say, Reverend Simon, what are some of the common conditions that we can notice when it comes to people with eye conditions? I can assure you there are a number of eye conditions that people go through in life. Some of the common ones, let me go through just quickly. Number one, some of these conditions are easy to be treated, and the common ones are these. What are some of the common eye conditions that people face, and maybe you or your relative are going through and they have experienced? Number one, we have maybe heard of a condition called cataracts. And you might be asking, what are cataracts? We have heard stories about cataracts. Cataracts, this is a condition which causes the natural lens in your eye, to become cloudy, leading to blurred vision, whereby you can't see. It's like there is smoke. You can't see clearly. The reason is very simple, because the natural lens in your eye has become cloudy because the cataracts are growing on it, forming like a cloud on it, and that will cause you not to see clearly. So that's a cataract vision, and cataract condition the vision will be going and going and going until you can't see anymore. And there are procedures nowadays in the world that that condition can be treated through an operation, which is a day surgery procedure. You just go in and then they operate, they take the lens out and put a new lens in your eye, and it's a day surgery procedure. And then you go back home, and after 5-6 weeks, you go back to the hospital for review to make sure that everything is settled down. So don't be scared of cataracts. So number one, cataracts are very common in different parts of the world. Almost every continent, people experience cataracts, which leads to blurred vision and loss of vision. Can it be treated? The answer is yes. Just go and see your optician, your doctors, an ophthalmologist, the doctors in the eye clinic, and they'll be able to advise and give you more information as what you can do. So today, what I'm trying to share with you is just basic information that can help you looking after our eyes, part one. Yeah, so number one thing that maybe you might be experiencing, or you know somebody who have experienced that, or who are going through that eye condition, we can help them, direct them, signpost them to the hospital to see the clinician. There is no need to fear to go to the hospital to be treated with this condition. Number two condition is glaucoma. And you say, oh, what is glaucoma? Glaucoma is a group of eye conditions that damage the optic nerve, often due to high pressure, which can lead to vision loss. So if your pressure in the eye, just like normal, when you go to the hospital, they'll tell you, can we check your blood pressure? Same principle. Blood pressure in the body tells you how the blood is flowing through your body, and what is acceptable or standard numbers that they're looking for, and all that in the observations. Equally, when it comes to the eyes, one of the things that our doctors and consultants and ophthalmologists will be concerned, and opticians, is to check your pressure in the eye. It's different from blood pressure. This is the pressure in the eye, because there are fluids in your eye, and there are blood vessels. They are bringing oxygen to the eye, bringing the nutrients. So the eye operates at a certain pressure in the eye, which is roughly between 10 and 21. Anything above 21, then you have to be monitored to make sure that it's not leading to glaucoma. Yeah, so glaucoma is a group of eye conditions that damage the optic nerve, often due to high pressure, because if there is so high pressure of the coming towards the eye, the optic nerves, they are very sensitive and very small, and they can't handle much pressure. So any damage to them can cause loss of vision. The third thing to look out for is age-related macular degeneration, called AMD in short. AMD, age-related macular, you can just tell from the name, age-related. So as you are growing old, as we are growing, you hit 40, up there 50, 60, your eyes also are aging, and your vision is getting distorted, and you're losing part of that vision. So AMD, or age-related macular degeneration, this disease affects the macula, the part of the eye responsible for sharp and central vision. And because the macula is affected, then your vision, the things you see, the amount of things, the sharpness of what you can see begin to deteriorate, begin to go down. So you need somebody to look after your eyes and check what is happening. I'm losing my focus. I can't see the way I used to see, the sharpness. I can't see clearly. It might be AMD. Age-related macular degeneration might be happening to your eye. So you need to have that checked. The area they detect it, the area you receive treatment, and the better you can save your eye. Number 4 is diabetic retinopathy. again, from the name diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the blood vessels in the retina and potentially leading to blindness. Yeah, so anybody, for example, in your family, there's glaucoma, there is a possibility that there will be some children or relatives in the family that might end up with the same condition of glaucoma. Equally, when it comes to diabetes, if there is diabetes in the family, there is need. It's very, very important to have it checked. So you can ask your parents whether anybody in the family has diabetes, and there are chances that you may develop diabetic retinopathy, a complication of diabetes that affects the blood vessels in the retina, and this can lead to loss of vision and can lead to blindness. Other people, they experience dry eyes, and dry eyes is a condition where the eyes do not produce enough tears or the right quality of tears, and this can cause discomfort and vision problems. So some people experience dry eye, and there is a lot of medication and artificial tears that you can buy, and by the recommendation of the doctor. Don't put anything in your eyes that the doctors have not recommended. Don't, because you might cause more damage to the eye, which cannot be repaired. Yeah, so if you suffer from dry eye, for various reasons, please make sure you see the doctors. You go to the clinic, let the nurses check it, let the doctors check it, the optician, and all the people that are in the medical field. They'll advise what is suitable for your eyes. So that's dry eyes. Another thing that some people suffer is conjunctivitis. Conjunctivitis, or what other people call pink eyes, is an inflammation or infection of the conjunctiva, clear tissue covering the white part of your eyes and inside of your eyelid. Yeah, so you discover that if there's an infection, you wake up, you may have a bloodshot eye, red and itchy, and it might just be an infection because something has gone into your eye. Or something is happening and it's causing problems at your eyes. So you can always have it checked. Other people suffer refractive errors. These includes nearsightedness, which is called the myopia, farsightedness, which is called the hyperopia. So you can tell from those names, the myopia, nearsightedness, farsightedness, or farsighted, that is the hyperopia. And also astigmatism. Also, there are people that have these refractive errors, which affect the eye's ability to focus light correctly, whereby you can't focus light into your eyes properly. So all these can be a problem to focus light. The other condition is blepharitis. Blepharitis, this is where the inflammation affects the skin around your eyes. Sometimes you find like it's swelling and all that. Blepharitis is very, very common. Whereby you've got sticky eyes and it's swollen and you don't know why. And there's anterior blepharitis and posterior blepharitis. Anterior blepharitis, this is when the inflammation affects the skin around the eyebrows or your eyelashes, where it is swollen around the eyelashes. Then the posterior, as the name is, this is where the inflammation affects your eyelid glands. There are glands around the eye, and meibomian gland begin to dysfunction, whereby it can occur when the eyelid glands become clogged with fat and other things in there. You don't need to understand everything, but when you see these symptoms and things happening to your eye, please make sure you go to the hospital, go to the clinic, let them check and to see what is happening. Yeah, so there are all these conditions. Others are seasonal allergies. There are people that have allergies during certain time of the year. Some people, when they're exposed to certain flowers, then their eyes are affected. Other people, certain perfumes, certain things, and also with our lovely ladies with makeup and other things. Make sure those things are not going into your eyes, because you might have a reaction to certain chemicals when they come in contact with your eyes. Our brothers and sisters that work in the industrial areas with heavy duty machines, welding and other things, those splashes and metal things, if they come straight into your eye, that can cause problems to your eyes. So these are some of the conditions that are there, and then you're thinking, okay, what are the symptoms? In my first video, which I did, you might have not come across it. I did share. It's not a problem for me to go back and reshare what I shared. This is on my health beat, and what are some of the symptoms of these eye conditions? How can I tell, and how can I be aware when I see something happening? What are the symptoms? What are the common signs of eye conditions? Some of the eye conditions, sometimes it's headaches. People have headaches, especially around their forehead, around the eyes. It can be an indication often related to eye strain. It might be because of glaucoma. It might be refraction errors to your eyes, so you need to have your headaches checked. There are people that experience all these headaches whereby they can't explain exactly, and they feel their eyes are being affected. Sometimes the other symptom is flutters and floating spots, where you see something passing through your eye, something like happening like a web or a flash of light coming across your eyes. This might be an indication of retinal detachment or vitreous detachment in your eye. And again, when you are experiencing floating objects in your eyes, you better go to the hospital, let it be checked. What else? What are the other symptoms to indicate that I'm having problems with my eyes? Double vision. Some people, they have double vision. You are looking at one object, you are seeing two things. Yeah, so it's not a demon. Don't stop casting out demons, thinking, oh, maybe it's a demon. Why am I seeing two things? It might be that you are seeing double vision associated with conditions like strabismus and or neurological issues, something to do with neuro aspect, your brain and something, the head. You might have had an injury or something, so that can affect your eyes. Blurred vision is a common symptom. You have been looking at something, all of a sudden you begin to realize, oh, that thing is not very clear. You are trying to read, and then everything is blurred. You close one eye, you look at an object, you close the other eye, you can sometimes tell. You can do a simple test of yourself. Close one eye, look at the same object, close the other eye, look at the same object, and you can tell sometimes the difference. And sometimes these objects are becoming so blurred. People that you could recognize easily, you look at them and it's like you can't see clearly. It might be an indication that you are having problems or cloud vision. This can be maybe the beginning of cataracts growing on your eyes. It might be glaucoma. The pressure is going up. Diabetic retinopathy. So these can be problematic and irritating. you need to see the doctor, go to the hospital. What else? What other symptoms? Also, sore eyes. There are times that you wake up or you were walking and then your eyes are sore and they are swollen. Why are they swelling? You need to have it checked. Other people, you have tired eyes whereby you can't concentrate, you can't open your eyes. They just feel tired. Others are drippy eyes where your eyelid just begin to drip. Other things is difficult focusing. You are looking at something and you can't focus. Your eyes can't just focus. All those conditions, you need to have it checked. Any growth around your eyes, maybe you had an injury, trauma to your eyes, can cause problems in later life, or when you are grown. So if there is an injury to your head around the eye, just go and let it be checked. Ask the nurses, the doctors, the opticians, to look at it. I am a faith person. I believe in prayer. Yes, people pray for us. I can pray for you, but I'll still advise you to go and see the doctor. Let them check and say, yeah, everything is fine. Carry on with your faith, believing God and trusting God there. But don't just say, oh, because I've prayed and I'm not going to go to the hospital. They give you medication and then you stop taking it because you have prayed. Now, God is the one that has given our doctors, our consultants, knowledge to come up with these medications. So please look after your eyes. They are very important. They are a great component of the body. I've never realized how important the eyes are until I started working in the eye clinic and working with people, and also going out to do charity work. And right now we are embarking on a charity work, going into Africa, going into Zambia to treat people for free. We don't charge anything when we go with the eye doctors. And this year we are hoping to make 2 trips, and we are sending equipment. And if you need more information, get in touch, and we'll be very happy to collaborate and to work and send the equipment into Africa and other places where people need to have their eyes tested. So these are some of the symptoms. And the last time I did mention, sometimes you say, okay, now that you've mentioned these symptoms, blurred vision, I can't see. Others, they can see when they are holding a book, and sometimes you notice you were reading a book, and now you start pushing it forward, backwards, back and forth. And sometimes it's just a matter of you going to the optician. They check they do a test on your eyes, and we need to be having these eye tests in 24 months, 2 years. Have your eyes checked. If you wear glasses, the opticians can tell you to say your glasses now are old, you need new glasses. There are a number of myths that people believe and have shared and told people, stop wearing glasses, you'll be dependent on glasses, you go blind. The opposite is true. If you are supposed to be wearing glasses that they have prescribed because your eyes can see better with glasses, and then you don't you are restraining your eyes, you are using more strength to see, and eventually that will cause more problems. Glasses will not make you blind. It's more or less like when you want to do work, which, for example, you can spend 5 hours, and then you get something or equipment that can leverage. You use it where you're supposed to spend 2 hours. Because of the equipment you are using, you spend 30 minutes. So what happens with glasses is that your eyes are straining to see something or to read. If you use correct prescription from the optician, and now you put on the glasses, you can see because it has made the letters bigger, so you're not straining your eyes. You can see clearly and better. So I want to encourage you, go and see an optician and have the glasses. And when they give you prescription, it's not there and then that you need to buy glasses from them. you can have a test and get your prescription. Now with the phones and other things, keep your prescription on the phone, take a picture or put it on your notes on your phone, and you can go to different places and look out on the market, search to say, this is my prescription and these are the glasses I'm looking for. You might find a place where you can easily buy glasses that are affordable and cheap. And if it's just reading glasses, you can just go into the shop and buy reading glasses, whereby you don't need to be putting them every time. You just use them when you are reading. There are plenty of glasses on the market, but if better enough, if you go to the optician or the doctor recommend and they give you prescription, they phosimeter, they check what type of glasses, the strength of glasses they are giving you, then you can go and buy glasses that are prescribed, and that will help you to see better. Finally, let me conclude with the blepharitis, which I did mention. Maybe before I conclude, there are times that we say, okay, if these conditions are there, is there any treatment? The answer is yes. When you have cataracts and you go to see the doctors, the opticians, the consultants, they will advise you and book you for an appointment. Cataracts, as I mentioned, is an operation that can take maybe just 30 minutes. Under 30 minutes, you can have a cataract operation. And you don't need to stay in the hospital overnight. You can go back home after the operation, and then you go after 4, 5, 6 weeks to have your review, so they can see that the lens that they have put in is working. Cataracts, there is no medication that you say, oh, if I buy some strong medication, I'll get rid of cataracts. Up to now, there is no such. Maybe I don't know, but as far as I am aware, there is no medication for cataracts except operation. They have to operate, take that lens out, and put another lens in your eyes, and it heals perfectly, and people are able to see very well. People are different. I understand that how the healing process takes place. It's different. Some people will succeed. Others, they may not, their vision will not improve. That's understandable with any condition and with any treatment. Number 2, glaucoma. Glaucoma, if your family history has got glaucoma, pressures going up in the eye above 21, then you need attention. If it's detected very early, they will give you, put you on drops. And these drops, all you need is get these drops and use them every time as instructed by the clinician. You can keep these drops in the fridge. Others are preservative free, and you can be putting them, for example, maybe the doctor says 2 times a day. So you just go in a routine, keep them in your handbag. You put them in the morning and you put them in the evening, and then you are done. And those drops will help the pressure to be kept in check. And time and again, go to the hospital. You can even just pass by the hospital and the eye clinic just to say, okay, I've got glaucoma. I want my pressure in the eye to be checked. I'm sure nurses and clinicians, they can make arrangements for you to have your pressure checked in your eyes time and again, so that if, for example, if you are not checking them time and again, and then the pressure goes up, there are people that pressure in the eye can go 30, 40, 50. It can damage the optic nerve at the back of the eye, and that might not be repaired. You go blind. Nobody has bewitched you, but you didn't monitor the pressure in your eye, and you needed intervention early. Go to the hospital, let them prescribe medication. Don't put anything else in your eye. Just use medication that is recommended. Even the information I'm giving you today, go to your optician and check out to say, this is how I'm feeling with my eyes. This is how I'm seeing. Please help me. What can I do? And they'll be able to help you. That's what they're trained for, is to help. And your vision, what you see, your vision is our mission. We need to help you to see better. If we can preserve just the bit of sight in you, that will be very good, so you can carry on with your independence and life, so you can see what you can see, than your vision just going down and down and down until you lose everything. But if there is an intervention, go to the hospital, let them check and see that they're helping you. Okay, I've spoken enough. And blepharitis, which I mentioned, blepharitis is a chronic condition of the eyelids, meaning that the symptoms will reoccur if not treated. So what is blepharitis? Blepharitis is a common inflammatory condition whereby you begin to see the eyelashes, they are swollen and they are sticking together, and it's very irritating. The eyes are becoming red and swollen and inflamed. So blepharitis is often caused by a buildup of bacteria living along the eyelid and eyelashes. So eyelashes, thank God for our ladies. They are very good at cleaning up the eyelashes and making sure they are in the mirror. So it's very important to deal with the blepharitis. This condition, and it's an inflammation of the eyelids, often affected both eyes along the edges of the eyelids. And these simple symptoms, you can tell that you have blepharitis. Number one, red eyes. Number two, swollen eyelids. The eyelids swells up, and you can see like kind of watery eye and crusty and frack skin around the eyes, and also becoming very sensitive when you look in light. Your eyes are becoming very, very sensitive, feeling like something has gone into your eye, and very greasy around eyelids, and sticking eyes, especially upon waking up in the morning. You can't open your eyes, it's discharging, it's red, it's swollen around. Yeah, so what causes blepharitis is the buildup of bacteria around your eyelids and your eyelashes. So it's very, very important to keep the eyelids clean. If you do not treat it, it will not improve, and your symptoms will remain and possibly worsen. Yeah, so blepharitis is one of the most common reasons to cancel if you've got a surgery coming up, and then you've got blepharitis infection around your eyes. They will cancel the major appointment that you are supposed to undergo a surgery because of that. Can you imagine something like that happening? So sore eye, red eyes, inflamed eyelids, and eyelashes, and visible dandruff around the eyelids. So it's very, very important. If you have blepharitis, you might notice some of these things in your eyes. What are some of the symptoms? Itch, sore and red eyelids that stick together. That might be an indication that you're having blepharitis infection around your eye. Crust and greasy eyelids, and also burning. You feel like your eyes are burning. Gritty sensation in your eyes. It's like you feel like, oh, something is in my eyes. My eyes are burning. My eyes are burning. Visible dandruff on your eyelids, and you begin to notice all those. And what are the possible causes of blepharitis? Blepharitis can be caused by a buildup of oil and debris in the eyelids and eyelashes. Oh yes, there's some dirty stuff building up around your eyes, your eyelashes, your eyelids. And bacteria eyelid infections. So because of bacteria that are built up, that will cause an infection around your eye. Complications of skin conditions such as seborrheic dermatitis or rosacea, you find that these can cause blepharitis. Meibomian gland dysfunction. There are glands around the eye that God has put around our eyes, And these, when they are blocked and there's debris around your eyes, it can cause all those. So what is the key? The first step that you can take: daily lid hygiene. Just your eyelids, wipe them nicely, clean them, wash them, wash your face in the morning. It is that simple. And use some good cloth to clean it. Yeah, that helps. Bronchitis and other conditions of the eye, such as meibomian gland dysfunction and styles, they come time and again, but they can be treated. The key element in the treatment of bronchitis, dry eye diseases, and MGD is the patient compliance, whereby as a patient, you just need to make sure that you have your eyes treated. Thank you so much. We may end here. I can hear the doorbell at my door ringing. Yeah, so we will end here, and thank you very much for today, for this lovely show that we have had today. Thank you very much, and God literally bless you. Thank you so much, and we are ending the show here. Thank you, and God bless.